Thank you very much for inviting me again. I'm totally enjoying it. All right, are we ready to talk about teens, tots and toxins? Yes? So I have some objectives here. So I'm going to give you a minute to talk about these 3-4 questions there and see if you can come up with some answers in your own tables. So a minute to do that, and then we'll talk about some of the cases we have here. I don't need you to shout out any answers. I just want you to talk among yourselves and see if you can answer these 4 questions. So 3 items at home that can be toxic if ingested. 3 major toxidrome, like, do you know their names? 4 important questions that you need to have or ask and have the answers for. And a couple of substances that are toxic and fatal in small doses. Thank you. So I hope you had a little chat, at least about some of the questions. So let's talk about the first patient we had. So we had a 16-year-old boy who was transferred from Trillium because there had been some issues with this child. So he came home from school, and then he had a meal. He also had some Coca-Cola, and then he was drowsy and dizzy. He couldn't even walk up the stairs, so Dad had to carry him. He started vomiting, but then he fell asleep, so they let him sleep. But then the morning too, he was not feeling well, throwing up, so he went to the local hospital. Okay? So he was triaged at 12:45, and in normal hospitals, unlike in pediatric hospitals, the nurses can get started with a few things. So they got some blood work done. He was seen by a physician around 2 o'clock. He was given some IV fluids because he was dehydrated, and then the labs came back. Okay, so what are we worried about? I put it in pink in case people were feeling sleepy and didn't want to do any work. Okay, so do we have all the labs we want for this child? No, but we have some, and the worrisome thing is the bicarb, right? Yes. Okay, so we got some more labs. But before that, there's something you can do even with incomplete data, and that is called the anion gap. And if you just looked at it, like most of us do, and I do that too, everything kind of looks okay except the bicarb. But if you actually calculate the anion gap, you know that there is a problem. And I calculated it up there. Okay, so the rule here, or the pearl here, is that even if you have incomplete data, use what you have to see what you can get out of. So repeat labs: hemoglobin, white count, pH. That's kind of bordering on the pH of a frog. Okay, and the bicarb has gotten even worse. So this child has no business to be so acidotic, and why is he having so much of acidosis, plus an anion gap? We also got some other stuff calculated. So we have an osmolar gap too, but he had no alcohol on board. So by this time, Mrs. Aga got really worried, called sick kids, and said, we are transferring a patient. They called the pediatrician, and they were going to transfer this patient. So, high anion gap acidosis, which one do you think it is? Okay, let's go from the bottom. Could it be salicylate? Yeah, maybe. Could it be ethanol? No, he has no ethanol. Ethylene glycol? Yeah, maybe. Lactic acid? No, he should be really sick with that amount of lactic acid. Iron or INAH? Unless his mom is pregnant and taking iron and he's 16 and doesn't know M&M candy from iron. or he has tuberculosis. It should not be that. Paraldehyde? Who has paraldehyde anyway, right? And why should he have paraldehyde at home? Diabetic ketoacidosis? Come on, not with the normal glucose. Uremia? Why is he in kidney failure? And then methanol? Yes. So we have an answer here. So it's either methanol or ethylene glycol. So we panicked, and we actually called Mrs. Saga and said, hi, can you do this, this, and this before you send the patient over? But the patient had already left, and it was traffic time, and then the patient very gently arrives at our hospital. So we got the answers, okay? So why are we worried about methanol or ethylene glycol? So, renal failure, what else? Blindness, what else? Come on, they can die too, right? Okay, all right, thank you. So, methanol flax, the lethal dose is 1 to 2 ml per kilogram if it's 100% methanol. The fatal dose is 50 milligram per deciliter or 15 millimoles per liter, as low as that. And who is the culprit? Is it methanol that kills, or is it something else? It's a metabolite, exactly. So, when you have significant acidosis, or if the levels are above a certain level, you have to start treatment. And the significant acidosis is because of the methanol metabolites. So, in spite of all these numbers, even something as low as 0.1 ml per kilo, which is 6 to 10 mils in an adult, can be fatal. So methanol metabolism, as I said, methanol per se is not the bad one. It's the formaldehyde and formic acid. Formaldehyde doesn't sound good because you preserve organs in formaldehyde, so it can't be really good to preserve living things, right? So, formic acid, that's the worst thing. We all produce a little bit of formic acid in our system, but that's a little bit. A little bit is okay, but when you have large amount of formic acid, it can cause blindness, it crosses the blood-brain barrier, it gives you severe acidosis, and you can die. So how do you treat methanol poisoning? You want to prevent methanol from metabolizing, so that's where you use famipazole or ethanol. Now, ethanol and methanol use the same enzyme to get metabolized. So if you give lots of ethanol, then the enzyme is very busy dealing with ethanol. It won't metabolize methanol. And then there were little doggies running around and licking stuff, the ethylene glycol, which is very sweet, and they made the doggy famipazole several years ago. It cost about $50 or something. But then you can't give doggy stuff to humans. You can give human stuff to doggies. So we have a human famipazole, which is costing how much? $1,000 per pack. Yes. But just look at the optics of it, right? If you gave the doggy stuff to kids, it'll be like Scarborough General or sick kids give dog medicine to children. So the optics are not good. So we cannot use the $50 one. We have to use the $1,000 one. But it's the same thing. So that way, we prevent methanol getting metabolized. But if you have significant acidosis, it's already metabolized. So what do? How do you get rid of this acid? So you can do little things. So you can give some folic acid or folinic acid, which is better, which will get the formic acid broken down into carbon dioxide and water. But the problem here is you cannot give so much of folic acid and all your formic acid will bubble up like, carbon dioxide and water and come out of your system. No, it doesn't happen. So this is what? A Band-Aid solution, which means you have to get this formic acid some other way, which means you have to send them to a bigger hospital to be dialyzed. Okay? So even if you do not have your methanol levels, which is going to take a while, if you have significant acidosis and a high anion gap, you have to get these kids out of there as quickly as possible, and you can give some folic acid just to tide over, put a Band-Aid in the meantime. So if you have ethanol IV, you give IV ethanol. If not, can we do anything else? You can give it orally. So there was a bunch of military personnel up north who had some alcohol, and someone thought that it was laced with methanol. So people were very worried. And you didn't have IV ethanol there, so they told the calling nursing station to give these service personnel lots of alcohol. So they all got vodka, I think. So it's about 2 cc per kilogram. You can imagine how the pilot felt when he was transporting them back to Toronto. Like, you have to be really drunk. So you cannot just give a little bit and be okay. So your levels have to be above legal drinking limits for the alcohol to stop the methanol from metabolizing. Okay? So if in doubt, get some vodka. So this is what our patient had. Toxic? Yeah. So what do you think we did? Dialyze, but we put the Band-Aid too. Okay? So here we did the ABCs. We gave some midas because he was very combative. We got the famiprazole started. We got leucovorin in, like all the Band-Aid things, while we took him to ICU, and then he got dialyzed there. Now, is there any public health concerns here? Yes. He drank Coca-Cola, remember? So where is this coming from? So the parents hadn't come at that time. He was transported, and they were on their way. And when they came, they said the siblings might know. So we called the siblings. We sent the police to go and grab all the Coca-Cola from the home, bring it over, sent it to the lab. And then we alerted the other neighboring emergencies to say, you know what, there's one kid with methanol poisoning after drinking Coke, so watch out for other kids. I don't know whether they had a party or something. And then we also alerted some of the schools. And the police were checking on kids who didn't go to school, so everybody got busted the next day. And in the ICU, this kid got intubated, dialyzed, he got the famiprazole, and then they continued the leucovorin, and at some point dialysis was stopped and he was doing better. The follow-up was that the kid would not say where he got the methanol from. So the Ontario Provincial Police was continuing its investigations, and kids continued to get busted when they didn't go to school. And then I was working the night shift the next day, and I called in the morning to ask my friend, the toxicologist, Margaret, and she said, kids not talking, Savithiri, we don't know where they got it from. There's no methanol in the Coke bottles that you got. So I thought, I have to have a chat with this kid. So I came a little early before my night shift and went up to the ICU and had a chat. Do you want the story? So, he was interested in girl X. Girl X was not interested in him. So he thought he'll try some antifreeze and die. So he did that over the weekend. And then Monday, he didn't die, so he went to school and tried again. And the girl was still not interested. So he went on Google to check what are the effects of methanol. And he had to decide whether he was going to be alive and blind and chickless. This is not something I made up. Or he would take more methanol and die. And he decided that dying was a better option. So he took some more methanol, and that is how he got sick. Jesus. Okay, so I said, listen, kiddo, you need some help. Is this girl really worth it? He said, not after the tube and all these lines. And I said, okay, good. So I said, you have to tell this to your parents so that we can stop these investigations. You know, everybody who's cutting school is getting busted in that whole area. So he considered that. And I said, you don't have to say this to your school, but you have to tell it to your parents so that we can stop investigations. And we did. So we called off the operation. Now you have two kinds of antifreeze. The bottom one, the concentrated one, is the 100% one. They probably had a concentrated one. The top one is a 60%. And this is available in every garage. And you have to be careful with this. Don't put it in. Tell your families and friends and your patients that they should not put it in water bottles or glasses. And be careful with that. It is extremely toxic. Okay? So now that we have talked about a teen, shall we continue? Cough remedy. So Vicky had a cough, and Grandma suggested a home remedy. Cough improved, and Vicky thought she should have some more of this remedy because she wants to go for a party over the weekend. And a few hours later, Mom found her acting a little strange. What do you think is the home remedy? Come on, shout out. Sorry, what? Robitussin? No. What? What tea? Bran tea? Okay. Does anyone know about honey and nutmeg? No? Yes, right? Honey for sure, and honey and nutmeg is really good for cough at night. So who do you think is the culprit? Nutmeg, correct. Okay, so what is in nutmeg? So nutmeg has something called myristicin, which is methylene dioxyphenyl. When you have these long names, if you want to sound smart, you have to break them into 2 or 3 pieces and pronounce it at home. And then you can rattle it off as if you know it all. I had to try it a couple of times. So anyway, so that's what is bad. And the effects are very similar to atropine. So heart rate, blood pressure, everything goes up, pupil dilates, and it bronchodilates. So that is why it works so well. So, how many of you have nutmeg powder and how many of you actually grate the nutmeg? You grate it still? It tastes better, right? Yeah, I do that too, but I also have the powder now. So, and it's really good for cakes and whatnot. However, you have to be careful that kids don't get hold of this, and it should not become the next cinnamon challenge or something like that, because they can get really toxic. And how do we treat them? It's usually supportive care. So you snow them with benzos so that they get calmer, and you cool them with water and ice so that they don't get hot. Okay? So my kids used to think that I make these things up, so I have to always give them references. They were annoying brats. They're grown up now and they're really good children, but they were totally annoying when they were teenagers. So that's your reference. Okay? Now, how do you remember which is cholinergic, which is anticholinergic, which is sympathomimetic? It's really hard. So I have an easy way of remembering it. Now suppose I pick a fight with anyone here. Let's pick a fight with Akhtar. Now, if I do that, I am totally crazy. And my heart rate would go up, my blood pressure would go up, my pupils will be dilated, I'd probably be sweating, and I will be crazy to do that. So that's your sympathomimetic. Okay? Now, parasympathomimetic is completely the opposite, and the dumbbells, and that's easy to remember. Everything goes down. Now, the confusion arises when you have anticholinergic. They are very similar to epi, but all antis hang out together, and they are antiperspirants too. So instead of sweaty, you'll be dry. What does it mean that all antis hang out together? So if you have an antihistamine, what do you think the properties are? They hang out together, so it's anticholinergic. Antipsychotics? Antis are hanging out together, so it's an anticholinergic. Okay? All right, so the only difference would be that one is sweaty and the other one is dry. And the craziness is slightly different. Now, the anticholinergic crazy is a little sad. It's a sad crazy. It's not so violent. The sympathomimetic is totally crazy. Like, imagine me trying to pick up a fight with your doctor here. That's totally crazy. Okay? So that's how you remember it. All right. Okay, one more case. Oh, I have a few more. Okay, mint candy. So 14-year-old boy opens a sock drawer and trying to find his socks. And then I'm really surprised that he even had a sock drawer. His mom probably did it. He probably throws the socks on his floors. Anyway, he found a small mint candy there and he ate it. It didn't taste good, so he spit it up. So a few hours later, the mom noted that he was looking a little pale and he was brought to the doctor. What do you think happened? Yes, I heard it. Yes. Okay. So this is the candy he ate. Okay. So how many of you have heard of naphthalene balls? Hands up. Okay. So all of us have heard of naphthalene balls, and back home in Sri Lanka and Southeast Asia and China, it's like God's given gift for moths. So it's the moth ball, and everybody thinks that's what you should use. You can still buy naphthalene balls in Canada too. So that is what this kid had, and someone already said G6PD deficiency, so he had naphthalene-induced hemolysis due to G6PD deficiency. So this has been documented and reported for years and years, and it still continues. So how common is G6PD deficiency in Toronto? So this is G6PD deficiency chart of the world. And if you know the ethnicity of your patients, you would know that it's more common in some of these patients than in others, and you have to warn them even if you don't do the testing. Okay? All right, now we go to TOTS. So 1-year-old was brought to emerge because she was not that well. The big sister was taking care of her, so she rubbed grandma's oil all over the child, gave some medicine. The big sister was a doctor. And then mom found both of them and then wiped off all the oil from the baby, sort of dressed her up in new clothes. But then after a while, the baby wasn't feeling very well, so she was worried. She started crying and vomiting, so brought her to emerge. That's the exam. So heart rate's up, respirate's up, blood pressure is kind of okayish for that age. Temperature slightly up, she's very sweaty, and she's smelling minty, and the cap refill is kind of abnormal, so probably shocky as well. So the cardiovascular and the central nervous system are kind of involved here. Any guesses? Yeah, I hear it. Someone said camphor. Okay, we'll keep going. So this is the poison story. It's a 1-year-old. What did she have? Grandma's oil 5 hours ago. How much, how many? Not sure. The tube was empty. Weight of the child 10 kilos. These are the vitals. What do you do? Any child drowsy, what do we do? Check the Sugar. Okay? So ABCDs, check the sugar, IV fluids because she's shocky, we did an ECG, we are not sure, we are just kind of fishing there and trying to make sure the child stays alive while we figure out what's going on. So glucose was okay. Any guesses? Aha. So where did this come from? It's grandma's? Yes, it's salicylates, it's grandma's oil. So, these are some of the other sources of acetyl salicylic acid at home. Tiger balm, if anyone goes to the southeast, they'll bring it. It's really good for your headaches. You wonder why. And then all these oils. So the white tree oil, white flower oil, that's what it's called. It has 60% of methyl salicylate in it. So it's a highly concentrated one. And that is why you get better. You put a drop in boiling water and you drink it and your headache goes away, right? Because you got some salicylate into your system. Bengay, that's another one. So oil of wintergreen, where do you buy it? Any pharmacy. And what do you use it for? Yes, and you can, some people rub it for pain, but you also use it for cooking. If you want to make cookies, you want the mint cookies, that's where your mint comes from. So 1 teaspoon can be really toxic because it has such a lot of ASA. Okay? So that's the level. So it's not just thoughts. I just put this up about the New York 17-year-old who died. She ran a marathon and then she rubbed Bengay all over her body and then she got possible salicylate toxicity and she passed away. So be careful. Don't rub too much. Anything in small quantities. Now we kind of don't take this skin very seriously. I'm sorry, we do when we have some diseases, but that's how you get medicines into horses, right? So horses with epilepsy apparently get it rubbed as oil on their skin. So if that can happen in big animals, just imagine what will happen in little kids. So you have to be careful on what you rub. Hence the answer about the Vicks vapor rub. Like, not just Vicks. Tell families, don't rub stuff on your children without knowing what it is you're rubbing. Okay, another thought. So this one was sleepy at school. So 4-year-old, she has been kind of sleepy at school, not doing that well, but she sleeps very well at night too. And nothing has changed. Actually, she's more independent now. She brushes her own teeth. She goes to the potty and wipes herself too. So parents kind of got concerned, went to the doctor. The doctor saw that she was not her usual self. And then she was giggly. She was okay, smelled a bit minty, was walking funny with a broad-based gait. So school problems, sleeping, broad-based gait, he kind of got very worried and sent them to Emerge. He couldn't see the funders. She's 4. She's not going to let him do that. Okay, worried? Everybody's smelling minty now, but apart from that, is the story worrying? Broad-based gait, school problems, too sleepy or too drowsy. Yeah, I hear some murmurings here too. Okay. So this one comes to the Emerge, and this is what it was. So everybody was worried, perplexed as to what it is. A CT head was ordered just to make sure it's not a posterior fossa tumor. The evening staff comes over, orders some blood test, and you're right. The alcohol level comes back that she's drunk. Not legally drunk. You have to be above 80 or 100 for that, but she's kind of getting close there. Now, where did this alcohol come from? The mouthwash, exactly. How much alcohol is there in the mouthwash? Percentage? How much? 10%? Okay, any other takers? 20? Any other takers? Okay, we'll get the answers. So Listerine has the highest alcohol content. You're right, it is close to 20. But others have different content. And if you have a teenager using a lot of mouthwash, either there's a new interest at school or he has found a cheap alcohol to drink. If you have little tots using alcohol mouthwashes, you have to be careful because it's really hard to gargle and spit out everything. So when you let young children start doing their teeth cleaning morning and night, you have to watch out for the mouthwash. Okay? So these are alcohols in other areas of the house and other things. And that's a reference if you want to look at it. So after this kid, of course, recovered eventually, but ended up getting the CT anyway, and the parents get cabinet locks and lock this away. Based on this case, we decided to look at alcohol in household stuff, and we looked at all the case histories and tabulated them all, and that's where you got the table from. Okay? If you have a drunk child, what are you most worried about? Aspiration, if they're totally drunk, aspiration. Anything else? Falls. Anything else? Hypoglycemia. So that's another thing you have to watch out for. So thank God this kid was just drunk and sleepy, but she could be hypoglycemic, and she could have gone hypoglycemic and seized or aspirated, as you said, or fallen off the bed and done something funny. Okay. So I'm very proud of this slide because I actually made that diagram there with the alcohol and the elevated stuff. So that's your legal drinking limit. And that's when you pass out and get into trouble. And, and further down you'll die. Okay? So the police use milligrams per deciliter. That's what the breath analyzer does. So it's just easier to calculate. We do millimoles per liter, and you may not know the conversion, but you could always look it up on Google and you'll have the answer in 2 minutes. Or like me, you could memorize it and check it periodically. Okay? So the questions, 4 questions in poisoning. Who is this kid? Age, weight. When? What time did the ingestion happen? What? Drug or chemical? How much? How many? Strength, preparation, or number? So anytime you have someone saying, oh, I gave too much Tylenol for my child, ask, which child? Who? How old? So you know the weight. When did this happen? Which strength? How much? How many? And then you have the poison history, because apart from ABCDs, it's important to estimate the dose per kilogram in children. However, there are some drugs where it doesn't matter. You just take one and you're dead. And these are some of them, especially in children. Some of them make sense, like calcium channel inhibitors. Come on, yeah, that looks serious. But something like chloroquine, the malaria pill, right? You go traveling, you come back, you don't always take your chloroquine on time. There are a few more pills for you to take afterwards. The kid gets hold of one tablet, they're done. And why? What does chloroquine do? All queens go to the heart and give you arrhythmias. So does chloroquine. Okay. Lomotil, again, another one, which you may not think of. So these are substances where you don't have to even bother with milligram per kilogram stuff. A small dose, 1 teaspoon, 1 tablet, 1 mouthful can be fatal. Oil of wintergreen. Okay, you get it in 5 ml bottles from the pharmacy. If you go to the grocery store, you get it in 3 ml bottles, oil of wintergreen. So a kid can easily swallow that. So poison management, we talked about this. Antidote decontamination and enhanced eliminations, you have time for that once you do the initial ones. Ipecac, no. Okay? Nobody uses Ipecac anymore. Investigations, bedside glucose and others. Activated charcoal, if you get them early but not useful in game, which is glycol, alcohols, acid, metals, and electrolytes. And these are the objectives and the questions we asked. Got the answers? We feel that our children are safe at home, but feeling safe does not mean that home is always safe. So advocate for home safety and keep toxins in your differential diagnosis. Thank you.